tena kwa mara ya pili, mpenzi mtazamaji wa runinga ya Nenyon. Nataka kukaribisha kabisa tuweze kuzungumzia kuhusu hali ya afya ya siku ya leo, na kwamba tuna mgeni hapa siku ya leo ambao tutaweza kuongelelea kuhusu hospitali moja hapa Kericho ambayo imeweza kunoga kabisa, imeweza kuwasaidia watu wengi sana kufuatia magonjwa mbalimbali. Daktari, karibu sana. Hii ni runinga ya Nenyon TV. Nataka wasalimie watazamaji alafu tuweze kuendelea.
Nashukuru sana kwa fursa hii. Nitaomba uniruhusu niongee kwa Kiingereza. Yeah. We are thankful for the opportunity you have offered us as a Greenview Fraternity facility to come and talk to the nation and the citizen about the health and ways we can manage and help them recover. Kwa majina, I'm called Oscar Otieno. I work at Greenview Nursing Home, just a few kilometers from town.
Yes.
Yeah, next to Kericho T-Boys.
Yeah. Daktari, most importantly, it's good for you to introduce yourself and what exactly you do, so that watazamaji waweze kujua exactly uko upande gani.
Yeah, well, in Greenview, I'm one of the clinical officers that work both in the inpatient and the outpatient department. We are a group of 3 clinical officers and 2 medical doctors. Yeah.
Well, talking about Greenview Nursing Home in Kericho, I don't know how many the types of services you are offering, maybe, so that we can start from the first, then we can proceed from there.
So when you come to Greenview, we offer so many services. One, I want to say that we are SHA accredited, so we offer services that that SHA can cater for. So at the outpatient department, we offer services like daily. We see patients daily. We review them. We tackle the outpatient cases, and then we have other departments like the inpatient department, where we offer. We give, we do the admission. So under admission, we have the female patient cases. We have the pediatric cases. We have the male cases. We have the surgical cases. And again, inpatient, we have a good theater that can that help us manage the patients. Yeah. So literally, we offer almost every services. We have the optical department, which we do offer too. We have dialysis in case there is a patient that is in need of dialysis services. That too we do offer. I've mentioned the inpatient. Again, we have the maternity cases, which we cater for. That include maybe delivery, or maybe if you want to do a cesarean section, we cater for that. And any other complication that may arise, we do tackle it.
All right, Daktari. Yes, the chief of network ko Daktari Oscar, not on a nemitenen sketchet, not on a Nenyon TV, NP to Tabrani. Ago iwe ndi connected in the Tagobo services taking which again you're in Greenview Nursing Home in Newton Kericho. Ago Kagamago Tindo services chechang missing about ICU tindo ana department sibo maternity aka services alak ago in kimachi amachi iger number security intermittent screening ngene kuni ago imuche bidisi moit en kasataga tukun not on call 0745 315 jotan ko ya 600 jotan ko number check jotan chibo simoit jotan chibo Greenview Nursing Home in Newton Kericho. Doctor, could you please tell us about when was this Greenview Nursing Home in Kericho incepted? Like, when was it introduced in Kericho?
Greenview has have a long-lasting history with different maybe change of department, change of management, but I'm not sure about that. Yeah.
All right.
Yeah.
Well, there's no problem. Now, talking about, I can see the very many services you are offering: outpatient, consultation, general inpatient. What exactly makes it different from other hospitals?
I do believe that Greenview we have caring health providers. We have negotiable prices to our services. Again, at Greenview, we are friendly, and we tend to make our vision and mission accomplish, and then we, at the end of the day, we always achieve to offer a good medical health, a good medical advice and help to our patients. That's at a particular moment, I've also made us stand tall as compared to others. Yeah.
Now, basically, I know you have some core values that makes you drive and maybe grow better than other health service providers. And now the most important thing is to know, why are you so best in offering the services?
We are so best because we have well-equipped, trained health providers who at any time of any day, they are able to always show up and attend to you in time of their need. That is one. Two, we tend to be people who are team members. If we gather around, put our heads together, and then we manage patients at the same moment. And then again, we can also talk about our location. We are strategically located in a well-situated area. We are easily accessible. Three, we have a variety of medication and medicines that maybe after you've been diagnosed by our able medical health providers, we'll have to give you. Yeah. Now, and then the last thing, we do also a follow-up activity to every patient that we take care of. Yeah.
Now, talking about the services you are offering, there are some critical services you are offering. Like, for example, you were talking about general surgery, orthopedic surgery, and optical eye surgery. Yeah. I do hope that you have all the required equipments for the testing and what have you.
Yeah, we have all the required system, and even if maybe we might lack or maybe we need a second opinion, we have always the other organization that we have with them a letter of understanding, so that we can send you to their facility, or we can refer you to offer that services. Yeah.
Oh well. Yes, Chita Quality Neton ko Greenview Nursing Home in Yuton Kericho. Ako in Kimiten Ag Daktari Oscar in Petuta Brain in Gaguma Ekole inendet ko one of the staffs Choton Chabo Hospitality nebo Greenview Nursing Home. Ningagama ragule Kimiten en kasartane goy ako tindo facilities che mujege testenen portang tugul angot Kimiten ko mutakala tugul gagama ro tindo services che tertere chebo general surgery, orthopedic renal services, services alak critical. Imagine the services choton critical che ngalolen chitap college ni ko choton chebo to mugulildo nebo pwonik nebo metit nebo moet ak nebo komaswek terter chebo to liver anan komaswek che gimwegelen critical body parts ago in anagelen body organs ago batile imuche nyoro services chuton ko ge number 0745 315 600 choton ko namba ishek choton chipo Greenview Nursing Home ako kora ko to market style amba che siko konech kora daktari namba ishek yik che muche itepsen nkuni ako ananibiru simet live ako muche olorchi ne twan kibagenge daktari. Now you have said that you have enough facilities so that that easily help the people to get the services easily. Now let's talk about the disease that has been a very big problem in the nation, talking about cancer.
Yeah.
Yes, can you elaborate how you help your patients maybe recover, and after some stages in life, you know, there are some stages in cancer that you know, how do you deal with them?
So first, if we have to talk about cancer, we sincerely have to know what cancer is, and maybe the causes, and eventually how we can manage, and what we can do in every stances. So mostly cancer is diseases that involve abdominal growth, abnormal cell growth. They can tend to spread at times, and then at times they cannot spread. So sincerely, sometimes it starts just like a growth, whatever in medical we call a benign tumor, just a swelling. And we have to know that is one of the most leading causes of mortality in the world, because at the end of the day, there are stages that when you have reached, when somebody has been diagnosed with cancer, and then if you are in a different stage, the best you can always be done for is palliative care.
Yes.
So when it reaches that point, we do help. And then again, we have to know probably what are the signs and symptoms, some of them that I'll mention a few, and then maybe when you come into our hospital, we will have a detailed talk. So most of the symptoms we have is, I've told you, cancer sometimes starts as a benign tumor, a swelling. So in instances, you can see just a lump or a swelling. They are cough, prolonged cough. In other instances, you can have a prolonged cough that maybe is blood-stained. There is loss of weight, or probably other people again can have loss of weight or gain of weight. Yeah. Then other instances we have, I've talked about lump, prolonged cough. So unexplained bowel movements. Yes. That is maybe in the intestines, and then maybe the abdomen, the stomach. And then we have bloody stool, or maybe you go to the toilet and then you realize you have a stool that maybe is bloody. The other things we need to know about the signs and symptoms, maybe fever. Fever is more of mwili kukua moto most of the time. And then we have night sweats, and for a duration of time. And then we have easy fatigability. You just feel like you are tired for so long. And then we have maybe reduced appetite. When we talk about prolonged cough, you can also be having maybe difficulty breathing. You can be having things like difficulty swallowing, and then maybe a blockage on your trachea. And then again, we have to know, so those we were talking about the symptoms, these literal things you see. Okay, there is also maybe frequent urination, but it is little. At times maybe difficulty in passing that urine. So cancer, at the end of the day, it depends with the type of cancer, and the site, and then maybe the stage. So there are those things we do that maybe can help us determine if this is cancer or maybe some other things. So under diagnosis, if you have to diagnose a patient, you have to take them for a lab study or an imaging study to determine if it is cancer. So under lab study, those few things we do, we withdraw blood, and then we take them for the lab.
Yeah, sidap kwalenchin neton ko ngalalet noton nebo daktari en betutab raini nekakonetech akobo miondo noton nebo cancer nekakomuch koim biik en kasarta nekoi. Noton ko miondo nekilele netai en nguni, miondo noton neibe sobonwekab biik en nguni en emetab Kenya akot en emotinwekab sang. Kakonetech kora akobo signs anan kaborunoik choton chebo miondo nebo cancer nekamwa kole imuch komin metit, imuch inyoru korotik, imuch inyoru uinwek en kasarta neilugui amitwogik anan ikose kora moet komamiten komie, yani ilungulige moet. Ako kakomwoe kora kole miondo noton nebo stomach cancer ko noton nekakomuch koim biik chechang mising, ako kaborunoik ko chon kamwoe nguni. Kakomwa kora kole miten cancers alak cheterter chekimoche ketestai nguni ketakinetkei akobo cancers cheterter, akomwa ortinwek chekimuche keteren cancer, ele kinyoito ak ele kimanagendo. Kakomwoch kora akobo palliative care. Palliative care ko en kasarta nekakwo barak cancer zaidi, komuche chito kuma lazima kobur en sipitali, kobaten yoche kobur en gaa akobedi daktariek chebo Greenview Nursing Home koba kokere akokere kole miten komie omisiet ako kabalansen amitwogik komie koboto beek ak tuguk tugul. Daktari, labda utuambie aina ya cancer ambayo labda imesumbua watu wengi sana.
Mostly the cancers that are okay, we have so many.
The common ones. Yeah.
The common ones, we have the lung cancers, probably on adult male, maybe with a history of maybe smoking. Then we have in female, we have cervical cancers, and we have breast cancer, the one that is mostly on male. We have the leukemias. We have the bone cancer of the bone. Yeah. So the most common one around, or probably the one I've met mostly now, it is always the lung cancers. There is cervical cancers for the women, breast cancers, and then abdominal cancers. Yeah. So the most common one in Kenya, I think, lung and cervical cancers.
Now, talking about those types of cancers, I don't know how have you put down the measures so that you can cover up this, how you can tackle these diseases? Because now that you have talked about the cervical cancer and the leading the cancer diseases.
Yeah.
Yes.
Yeah, there is always measures to try avoid, try to lower the risk of having cancers. So most of these things, they have a causative, but there are ones that maybe are inherited, or the ones we call genetic. Maybe if your parent had a cancer and then you inherited the genes, there's a likelihood that maybe eventually, maybe at the end of the day, you will always be having, you might also have cancer. So there are those few things we do, like it is advisable that you do screening more frequently. You do screening. There are those again that we say you modify your lifestyle, like as much as some are hard to maybe refrain from, but it is always good. So when you talk about lifestyle, there is the smoking idea. It is always good to avoid smoking. There is air pollution, which it is a whole hand issue to avoid the air pollution. And then there is, I told you there is always gain of weight in some cancer. So in such kind of instances, again, you have to do exercise. And then the other things you need to do is it is always good to see a doctor when you have a complaint, than self-medicate yourself while maybe that particular thing is not what you are medicating yourself. And then again, treat the other infection like sexually transmitted disease. In other incidents that may arise, it is good to always treat them. And again, you also have to, I say, do a screening. There is always vaccination for the ladies that they do. It is always good to do that. Yeah. So when you come to our facility, we are able to screen, we are able to vaccinate, we are able to see a patient that maybe have a complaint suggestive to that, and then we do the imaging just to roll out in prior. Again, we have qualified profession that can always talk to you in regarding to maybe if something is suspected, they can always talk to you, give you an advice, give you options, and then may explain for you more what might arise.
Yeah, very true. Yeah, chita kwalenje netan ko Daktari Oscar ne inete chen petu tabrani agobo services chemu chego goito Greenview Nursing Home Kericho ago ko ulegerta ye ko services choton che teseta ye ko borwech in screen ten kuni ina ile services ko kagumagele miten kora services chebo to dental health care, miten kora family planning, miten pediatrics, miten optical not agonde bagonyek, orthopedic ko not nebo nebagawek ak general surgery. Kagamagule ngele general surgery ko noton netinyege agin ingsit noton nebo porto anan komosta age tugul en porto ago imiten kora general inpatient kimuche got keger kele imuche itinye in koimutik ko imuche kegerin anan keadmiten in hospitali. Miten kora outpatient consultation noton ko ngot itinye kit age tugul nekaimin en porto akimach iteb akinyoru arorutik iger ile kenyoru konyoiset en Greenview Nursing Home Kericho. Ago ibati nambaishek ab simet choton nebo Greenview Nursing Home Kericho ko 0745 315 600. Angot imuche ibir nguni simoit ibir namba noton ago imuche kenam nguni akiteb tebutiet age tugul. Kakonete kora kole miten in other services cheboto intensive care unit ko ripset noton nebo chito maybe ne komang'u en surgery anan en kasarta ne konyoru yengset koboto kora intensive care unit. Miten kora high dependency unit ko HDU ko kimoche kiarorwech ngunon kele HDU ko ngotomine nene ak difference netingenge HDU ak ICU ko ne. Daktari, I'm trying to figure out the difference between intensive care unit and high dependency unit. And if you have those services, I know it's a little bit expensive, but I know with the bargain and what you have said, it's very possible.
Yeah, at Greenview we have both. We have the ICU. Those are for critical patients that maybe they need a close follow-up or close monitoring. And then we also have high dependency unit. High dependency unit is a patient that maybe will also need the close monitoring, but the GCS is stable. In ICU, mostly you find a patient can be intubated, so maybe to help them breathe. But in HDU, the patient might be in a position to breathe by them without being intubated.
Doctor, among the services that I've seen here, I think this is the second part of the services you are offering. We have talked about preventive medicine. What do you understand? And kindly explain to us what do we mean by preventive medicine.
Preventive medicine, like I was telling you, we have a qualified health professional that may talk to you in a case. So preventive medicine are those services that we offer, maybe just to prevent a recurrence, or maybe, let's say in your family there is somebody with TB. So we are going to treat that person with TB, but we are likely to give you a preventive medication to help you not acquire attach the same TB from the other person.
Okay. Yes, jitab kolen chini wat kora ile among the services che goito Greenview Nursing Home in Newton Kericho ko nebo to miondo noto nebo muguleldo. Doctor, I think you could it's better for you to explain to us what we mean by cardiology, and most importantly, I know cardiology is maybe diseases, maybe to deal with the heart or something like so, or the blood flow. So maybe you can explain to us so that I can tell the listeners as well.
So cardiology mostly involves the heart and heart complications. So under cardiology, there are those issues maybe with heart failure, or maybe cardiomegaly, moyo kukua kubwa. So under such kind of instances, under cardiology, we are likely maybe to do other services to maybe help your heart. If let's, for example, talk about bradycardia, that is when your heart is beating at a low pace as compared to a normal person. Those interventions that you are likely to give in to help your heart pump as corresponding to the demand of blood of your body. And then again, if maybe there is a heart failure or maybe cardiomegaly, moyo kukua kubwa, there are again those medications that we give, and then there are those literally imaging or maybe lab results that we undertake at Greenview. For example, under cardiology, we have the echo ECG to see how the rhythm of your heart, and we have other tests that we also do in accordance to the presenting factor that maybe affect the cardio part of it.
Yes, jitab kolen chini kagonetech daktari en petutab raini agobo miondo noto netinyege ak muguleldo ak korotik ago yoni watile most of the people ko bwate kolelen yang nitinye miondo noto nebo muguleldo ko ui kinya ago kagomwoe chini petutab raini Greenview Nursing Home en Newton Kericho kole imuche konya miondo noto nebo muguleldo, imuche koyai operation ago toretin in koimutiet age tugul because miten lagok chechang chongen ale bune anan tindo shida noto nebo miondo noto nebo muguleldo ago kikoik konukut ago miten biik chemongen kole kinyorunen ano konyoiset, kinyorunen ano toretet. Kagomwaunen betutab raini Greenview Nursing Home ago ibwat ile miten Newton Kericho ago ine kagomwoe komie agobo miondo noto nebo muguleldo ne ingen ile muguleldo kou kele the center noton nebo ne controleni kit age tugul en bortangung. So ngot ko menya muguleldo, ngot ko miten kit age tugul, ngot ko miten konda, kotam komwoe biik kole kibendi India, kibendi China anan kibendi komoswek cheterter asikenyor konyoiset. Kobaten ni Greenview Nursing Home ko komwon kolenjin koimutik tugul ngotko miten chi neo ngotko miten lakwa neming'it chi nebo kenyisiekab kwen netinye koimutiet age tugul nebo muguleldo nursing anan Greenview Nursing Home kotindo walutiet en inye. Nambaisiekab simoit ko chon ikere en screenit ak imuche ibir simoit ak iteb consultation ak service alak tugul komiten en Greenview Nursing Home. Daktari, let us also talk about we have talked about intensive care unit, the ICU, high dependency unit, preventive medicine, and then cardiology, that is the maybe the heart disorders or something like so. Now let's talk about dialysis. Yes.
So dialysis, under dialysis, we talk about kidney and kidney issues, or rather kidney failure. We all know there are so many. So there is always acute kidney failure, maybe that does not really need dialysis. And we have a chronic kidney failure. In short, it is always called CKD, where your kidney cannot do its work. So under such kind of instance, we initiate a patient on dialysis. So to remove the excess fluid or maybe the excreted waste material of the body, so that the patient can have a long life or maybe recover well. So under dialysis, Greenview, we have a dialysis, and I'd say it is SHA accredited. Initially, before SHA came in, we had NHF, which was catering for the dialysis, but we again tend to believe that with time the SHA will also cater for the dialysis. So dialysis is always done in a correspondence to the level of creatinine and urea. If it is too high, the doctor might recommend maybe 3 times a week or 2 times a week, or maybe just once a week. So in a simple term, dialysis is just to help the body excrete excessive waste product like fluids.
Yes, I've called in Niton ko Greenview Nursing Home ako kakonetay kumnya kopo kimuche ketoret na kopo dialysis. Most of the people ko magulelen SHA and Social Health Authority ko mamuche ko toret private hospitals, lakini kakomwache ni petutab rani kole imuche kotoret ni bati le kimiten kiyanat Greenview Nursing Home in tetutiet nekibo tano to nekibo National Hospital Insurance Fund, lakini en nguni ko kakomwa komie kole accredited ako kimuche konyor toretet en Social Health Authority. Ako ibati le noton ko kin ana neboiboenjin biik en kasarta age tugul niton ko Greenview Nursing Home. Daktari, let's go to gynecology and obstetrics. Under
gynecology, this is a condition that probably affects women. So again, I told you earlier about cervical cancer. It will always fall under gynecology. And then we have the obstetric mother. These are services that involve maybe a woman in a pregnancy stage. So under pregnancy stage, we have what we call MCH, mother-child health care, and then we offer the services prenatal and postnatal and maybe during the natal. So here we follow the pregnancy to term. Let's say from the moment the mom gets pregnant, it is always fair enough to attend clinic. The World Health Organization recommends at least 8 visits during the times of pregnancy. So it is always good to follow up. So we start by following the mother during her pregnancy session. Any complication that may arise during the pregnancy, probably maybe malaria, urinary tract infection, maybe loss of blood, anemia. We follow the mom during that stage. And then we have during delivery, we offer delivery services, and I believe we are one of the well-equipped and well-standardized staffs that give help mothers. So at obstetric and gynecology, during there you can choose your mode of delivery, which I said we do offer theater, the cesarean one, and maybe if you also like, you can just do a normal delivery, provided the conditions allows. Yeah. And then we have postnatal, that is after the mother had given birth. There, I know pediatrics will cover maybe immunization of the child, but again, we need to follow the mother after she has given birth. So we offer those services, postnatal care. So postnatal care, if it's a mom who had gone through CS, we always give you a time to come and then we check the wound. We also need to see the progress of how the delivery happened. Yeah, and then again, and there, I believe we do this. The charges when you come to deliver is friendly enough.
Friendly enough.
Yeah.
Yes. Yeah, jitap kolenjin kagonet daktari kolenjin en kasarta nagai chamage ago in imache isor tondet imache inyoru tondet en Greenview Nursing Home ko ye nyoru tondet en charges che imuche aginye chutor kakimwauni bebaitu akobebaitu agarwengung akobeka komie en boiboiyet netan ko Greenview Nursing Home na daktari now that we have 10 minutes remaining so that we wind up let me know your partners. Let me know your partners, those who are supporting you in maybe in one way or another.
I said we have two MOs, and then we have 3 clinical officers, and we have nurses and nurses in charge. I think it is fair enough to also mention our CEO or maybe the director. It's called Benson Kimemia, a very good guy, a friendly man. And then we have our nurse in charge and director of services, Mr. Amtai, a very good nurse and a very good person. We have a nurse in charge. She's called Pamela. She's also a nice person. And then under medical fraternity, clinician fraternity, we have Dr. Dominic, who is our daily to daily hemo. If you come and maybe you want to see him or you have appointment with him, he is always going to be available. We have Dr. Langat Vincent, who is always available over the weekend. If you want to, you have an appointment with him, you can also come. Then under clinician, I'd mentioned I'm a clinician. We have Mike Tuwei, who is a colleague, and we have Mercy Chip Kemoy, who is a colleague, and then me, Oscar. We have the lab technicians, we have Edith, and then we have, there is radiology. We have people responsible for that. Nurses, I can just mention a few. We have Faith, we have Olympia, we have Barbara, and then we have Doreen. A few among the many.
Now, the most important thing that I've seen in the banner here with us today is KWFT, Trident, Ritam, CIC Group, UAP, and another logo that I don't know its meaning. So maybe you can explain to us. But those might be the medical covers.
Yeah, they started by saying Greenview is NHF accredited.
Yes.
But despite that, we also have other covers that if you have, you should not shy away from seeing us. Yes. So we have the Britam, we have the Trident, we have the CSC Group, we have the UAP, and then we have KNAR. We have again the one they called for police on.
Yeah. Oh yes.
Yeah. I think it is the same one with teachers again.
Yes. Yes.
Yeah.
Okay. Yes. Jida College Newton ko Greenview Nursing Home in Newton Kericho. Ako in kitinye daigosiek tuten asikiwongun ako amongole kakinetin komyo kainetake akobo services choton chekoito Greenview Nursing Home Kericho. Ako in ibwati nambeshekab simet ko 0745 315 600 0745 315 600 choton ko nambeshekab simet chemuche ibir en kasarta age tugul ak itep tebutiet age tugul netinye akobo kit age tugul ne kakemwa kele inyoe mionwogik choton chekimwoe kimuche kemwa kele chronic anan ko choton chebo tinyege ak organs choton che critical en portangung ibati de muguleldo ko one of the organs ne play a very key role in portangung miten kora liver miten kidneys miten kora moet miten kora lungs miten mionwogik kora che much ko imbi kechang noton ko kimuche kemwa kele diabetes miten kora miondo noton nebo high blood pressure Miten kora mionwek cheterter cheboto miondo noton nebo keldet. Angen ale most of the people kobwote kole nan kaamin keldet kityo ko kasinyin ko kinem acha maunon kakomwa kole miten consultative services cheke anan sinyoru toretet ko nyokeker ak keker kele ngwany tos kakoyam kinem anatomo ko choton ko consultative services chemiten en Greenview Nursing Home. Miten kora konyoiset noton netinyegei ak konda. Bik chechang komwa kolelen eye ngalekab konda ko ui kenyor en sipitalisiek choton alak tugul, lakini kakomwa Greenview Nursing Home en betutab rani kole imuche inyoru toretet ngot itinye kaimutiet age tugul en kondangung ko imuche inyoru toretet en Greenview Nursing Home. Daktari, as we wind up, what is the most important thing you can say that will make people come to Greenview Nursing Home?
The most important thing is we offer a good health care, at a affordable price, with friendly and welcoming people, and I believe we also have a well-stored pharmacy. We have different medication, and that will help you when you come. Again, we are time conscious. When you come to us, we won't keep you for long. We will always see you as a priority, work for you, and then allow you to attend other issues that may arise.
Yes, chitab kolenjin niton ko Greenview Nursing Home. Ago amache abwatun kora ele kinyorchin Greenview Nursing Home. Greenview Nursing Home komiten townit noton nebo Kericho. En oret noton nebo James Finlay's opposite and en oret noton nebo Kericho T-Boys. Noton inyoru en Kericho Town. Kericho Town en oret noton nebo James Finlay's. Ago en kasarta age tugul nikenyoru ak imach toretet ko nambaisiekab simet ko 0745 315 600 0745 315 600. Daktari, maybe you have said the reason why people should come to Greenview Nursing Home is because you offer the quality services. Maybe the last word as we wind up.
Since this is a customer care week, I will first take it opportunity to thank our customers. I know they are patient, but at the end of the day, they are customers, for trusting in us and believing in us to take care of them and maybe help them solve the issue at hand. So we appreciate that, and we are grateful for trusting us. Two, we also encourage you to continue trusting us with your condition or with your problem. You should not just come to the hospital when you're sick. Maybe you want just to have a talk with somebody. Something is too heavy for you to carry alone. We will always give you a listening here. So don't shy away. Just you don't even need to knock. Just come in.
Yes.
We will take care of you. We'll take care of you.
Thank you, Daktari. Maybe do you have some other branches in some other places maybe?
No, we don't have branches, but I'd say we have those other facilities that we have a letter of understanding with. If we need their services, we will always refer you to them.
Thank you. Chitab Kolenjin,